Acción Médica Cristiana. Together we build our future. In the heart of Central America is the land of lakes and volcanoes, with a history of dictators, revolution and US hegemony. Nicaragua is a third world country, not because of the land itself, which is unusually rich in natural resources, but because social structures do not favour the poor majority. Nicaragua is a rich country with impoverished people. For the majority of Nicaragua's 5.4 million people, the current challenge is daily survival, as many earn less than $1 a day and endure substandard conditions for health, housing, nutrition and education. Impoverishment is even greater in the remote parts of the country.
Que la costa atlántica tiene factores de vulnerabilidad que no
The Atlantic coast presents vulnerability factors not seen in other areas of the country. Poverty is a determining factor in shaping the conditions of vulnerability.
The principal problems of public health in Nicaragua are rooted in poverty. How can we define poverty? It is the absence of power and is related to the inability of people to satisfy their basic human needs. The poor and non-poor are created in the same image of God, with equal promise of realizing full human development. Poverty is the absence of power to fulfill God's gift to every human being. Acción Médica Cristiana, or AMC, is one example of a response to address the increasing impoverishment of the Nicaraguan people with models of empowerment. Empowerment gives people control over their own lives as they participate in determining the life of their community. What is Acción Médica Cristiana? AMC is a Christian ecumenical organization of Nicaraguan health and development professionals committed to serve marginalized communities throughout the country. AMC's 25-year history and faith commitment has helped improve the lives of thousands of people in the poorest regions of Nicaragua. In 2005, a plague of rats destroyed thousands of acres of food crops along the Coco River.
Here, everything that is planted from year to year is lost. The basic crops here are rice and beans, and this year they lost their harvest again.
Jocelyn, at 1 year of age, weighed only 9 pounds. Her condition was critical, and her mother had no resources to travel hours downriver to get medical attention. AMC's emergency response brought immediate food aid to 90 communities and the implementation of new farming practices.
Thank you. Thank you.
5 months later, Jocelyn was out of danger, but emergency food aid was not enough to ensure her recovery. Model farms for teaching have become a long-term response to change cycles of scarcity. 4 years later, Jocelyn thrives and maintains her health. This is a happy ending for Jocelyn and her family, but thousands of other children, between 35 and 50% of all children under the age of 5, suffer from malnutrition. AMC has worked for 25 years to change this reality.
Mortalidad materna, mortalidad infantil, hasta hace unos años eran exagerados en esta zona.
The levels of maternal and infant mortality were extremely high until just a few years ago. Today, especially in places where Acción Médica Cristiana has a presence, we see that these numbers have gone down, and we see that communities have developed great capacity to respond to their own health needs.
The achievements of AMC and local communities are many, but other issues continue. Communities are prone to disasters, have little access to medicines and clean water and sanitary conditions. And HIV/AIDS is a growing problem in Nicaragua. Violence and sexual abuse contribute to the condition of poverty. AMC continues to work to change this reality.
Acción Médica Cristiana comenzó en
Acción Médica Cristiana began with a very clinical approach. The emphasis was to treat sick patients.
En momentos posterior,
Later, Acción Médica Cristiana saw the imperative to create a health system centered on the community. This required creating a network of trained community workers to carry out this work: midwives, first aid volunteers and health leaders. As the Nicaraguan Ministry of Health resumed its role as provider of clinical health services, AMC broadened its approach to address the deep-seated social issues that limit opportunities for local communities. AMC now works in multidisciplinary teams of health and development professionals, public health doctors, dentists, pharmacists and nurses, educators, disaster prevention experts, social workers, psychologists and agronomists work together to strengthen local capacity and participation at the community level. The organisation's target population is over 90,000 people among 150 communities in some of the most isolated and historically marginalised areas of the Central American region. Populations served by AMC represent Nicaragua's diverse ethnic and indigenous groups: Spanish descendants, Afro-Caribbean, Miskito, Mayagna, Rama and Garifuna. Today, the priorities for AMC lie in three major areas: community health, food security and disaster prevention and response.
Trabajamos agua y saneamiento.
We work in clean water and sanitation, building latrines, wells, collecting rainwater, and promoting community hygiene.
For HIV/AIDS prevention, AMC uses the local church and young community communicators to reduce stigma and discrimination of people infected with the virus and inform the population how to avoid epidemic proportions of AIDS in Nicaragua.
Let us show solidarity by sharing the gospel with those infected with HIV and AIDS. This is a campaign of Acción Médica Cristiana together with the Association of Pastors of the South Atlantic region.
For those who already live with the virus, AMC serves a self-help group with spiritual and material support.
Debemos de apoyar todos aquellos
We
procesos.
should support any effort that provides care and direct contact with people living with the AIDS virus, understanding their lives and their hope for the future.
AMC makes essential medicines available through community pharmacy networks. Low-cost quality medicines are accessible in over 200 far-reaching communities of Nicaragua.
Primero que hace el enfermo.
First thing a sick person does is go to the traditional healer or to the spirit. We work to cure the sick by using doctors, commercial medicines, and medicinal plants all together.
Somos un programa de salud comunitaria. Ese es nuestro principio.
We are a community health program. This is our main goal. Our approach is not just curative or clinical health care, because we look at health from a holistic perspective. That is why our projects have so many components.
la seguridad alimentaria.
Food security is also part of what we do. We have 3 land banks for farmers with no land and a project to grow vegetables in small backyards.
Food security is making sure poor people have enough of the right food all the time and into the future. Model farms, diversification of crops, reforestation, seed banks and commercialization of harvests will guarantee the nutritional security of communities. Success in nutritional improvements stem from AMC's experience of responding to 15 emergency and disaster situations.
The day before Hurricane Felix hit, Acción Médica Cristiana, with support from community leaders and accompanied by the Army and police forces, we're preparing small search and rescue groups for the next day.
Creo que el sistema de alerta temprana que teníamos,
The early warning system that we had allowed us to alert communities to what was coming, and I think that people were prepared.
En principio nosotros aquí venimos asignados para
We were brought in to help the process of needs analysis and damage evaluation.
Como comité somos los encargados.
We are responsible for receiving the aid and getting it to communities.
La gente se ha desvelado todos los días, ¿verdad? Han estado trabajando.
The community has worked all night for many days. They have gone to the farthest reaching communities to look for the missing and to bring help. Through risk mapping, search and rescue efforts, refugee centres, training promoters to provide mental health care and changing practices that contribute to global warming, AMC enables communities to reduce human, material and environmental loss in emergency situations and to invite opportunities for long-term development. Who carries out the activities at the level of the community? AMC's biggest asset as an organisation is the broad network of over 2,500 community volunteers.
Tenemos una red de promotores de higiene bucal.
We have networks of dental hygiene promoters, of midwives working to raise health consciousness among pregnant women, and of community volunteers with essential medicine cabinets. Community organisation and empowerment continues to be the strongest part of our project. We work to develop small businesses with groups of women. Some have a sewing workshop, others have a cow project. Many have as little as a second-grade education, but they are often the first and only to respond to a health need in their community. AMC's work in health and development is not merely a humanitarian response. The faith values that undergird the life of the organisation reflect the call to follow Jesus' words in AMC's signal Bible verse from Matthew 25:40. I tell you the truth, whatever you did for the least of these brothers and sisters of mine, you did for me.
La fe para Acción Médica Cristiana es nuestro hilo conductor.
Faith guides our way. We do not look at differences of creed or religion, but the biblical principle that God wants us to have a life and have it abundantly. We are made in the image of God. We have a right to live a full and healthy life. Cross-cutting themes such as intercultural, intergenerational and family relations, human rights and equality between men and women complement the strategies that seek Christ in all aspects of life and promote a culture of peace. Research and publications make AMC's experiences available to broader networks of participation. Short and long-term national and international volunteers and partner organisations contribute to AMC's efforts. Support for AMC comes from over 30 partner agencies in the Northern Hemisphere. AMC also participates in national and international networks and alliances.
Life for the poor, we need to struggle in the good times and the bad.
The evolution of this dedicated group of professionals positions AMC as an agent for change among the poor. The focus of development that we talked about is different in this way. It asks people, what does God want for you? And that is the essence of a biblical worldview. To know what God wants me to do, how God wants me to see the world. We believe that this way of looking at development is more complete. People don't just want things, but they are thinking differently and changing their behaviour. Now in its 25th year, AMC is launching a new 5-year plan to address the root causes of health problems, building local capacity that brings hope and empowerment for the future. Acción Médica Cristiana. Together we build our future.